Hello, assalamu alaikum everyone. Myself Vishal. So today I'm gonna present the anatomy of heart. So let's begin. General introduction. The heart is the central organ of cardiovascular system. The function as a muscular pump circulating the blood throughout the body. It is mainly composed of heart muscles, myocardium. Heart is mainly composed of myocardium. Okay, the myocardium, which forms a sac-like organ divided into four chambers. There are two atriums and two ventricles, remember, and these two are divided into left and right atriums and left and right ventricles. The heart is enclosed within the pericardium, forming a part of mediastinum, the partition that separates two pleural cavities. The position and size of heart. The heart is located in the thoracic cavity, specifically within the mediastinum. Around 60% of heart lies to the left of the median line plane. As we always say, the heart is in left. The heart is actually not completely to the left side of our chest or body. It is around 60%. Okay, as you can see there, that typically extends from third to sixth rib throughout. Though in cats and dogs, it may reach the seventh rib. The base of the heart is positioned at the level of mid-thorax. Okay, the mid-thorax, the base of heart. We'll discuss this for the base and apex further in the diagrams. Okay, while the apex is directed caudoventrally, it is mostly covered by the lungs except the cardiac notches. Okay, where the heart is more directly in contact with the thoracic wall, or separated only by pericardium, pleura, and mediastinum. In young animals, the front cranial part of the heart is closed by the thymus. The heart extends caudally to the diaphragm, resting just above. Okay, there are species, breed, age, health related variants in heart size and position. Okay, these are some minor differences, and on average, the heart makes up about 0.75 of the total body weight. In radiographs, the size of is often assessed by intercostal space measurement or by the comparing vertebral length. Now let's go on. This is a X-ray. Although this is not veterinary related, this is of a human male. So this X-ray was taken from the back side, and it is a chest X-ray. You can clearly see this is a heart. Okay, so this is the median plane. Okay, and this here, the base of the heart. It, as you can see, this is directly directed towards caudoventrally, and it is resting just above the diaphragm. This is here it is the location of diaphragm. Okay, so it is resting just above the diaphragm and directed caudoventrally. Now then, the pericardium. The pericardium, also called the heart sac. The pericardium is a fibrous covering of the heart. It is essentially a deeply invaginated sac. With its lumen, the pericardial cavity being reduced to a capillary cleft. The capillary cleft contains a small amount of serous fluid, which reduce the friction during the heartbeat. The pericardium can be subdivided into pleural pericardium, fibrous pericardium, and serous pericardium. So the pericardium is mainly divided into fibrous and serous layer, but it can be subdivided into pleura pericardium, fibrous pericardium, and serous pericardium. The pleura pericardium. When the parietal reaches the mediastinum, the parietal pleura, the space in the chest containing the heart and great vessels. Okay, it folds back on itself to line the inner surface of the fibrous pericardium, forming the pleura pericardia. Lungs. The pleura lining within the pericardial sac helps reduce the friction between heart and surrounding structures, facilitating smooth movement. The pleura is not covering the heart. Remember, it is covering the fibrous pericardium, the outer covering of pericardium. Okay, the pleura pericardium it just folds back and make up the space for the heart. The pleura pericardium. Okay, the fibrous pericardium. It is a tough outer layer of the pericardium that surrounds the heart. It is a conical shaped sac composed of dense connective tissue, including collagen and elastic fibers. Okay,